being agile basically just means being more nimble, easier to work with, faster, data-driven, and making sure you have the right connecting points so you can come and translate to the proper answer you're looking for.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. Today's topic involves adaptation and innovation, which is quite appropriate for our current healthcare environment. The word of the day is Agile, A-G-I-L-E. Joining us today is Arti Pullins, founder and CEO of Pundit Consultantz, a healthcare consulting company in Chicago. Welcome to the podcast, Arti.
Thank you very much, Bob. Thank you for having me.
The world has seen Agile development for a long time. It started about 20 years ago in the software development world. And I have a little bit of software background. And back in the day when I was doing things, it was all top-down project management, lots of noise and very little work gets done. And most of those projects never became a real project. And so this Agile thing kind of got going in that direction. So why don't you share with our audience some of the core ideas or principles of Agile and how it's made its way into the world of healthcare?
Sure, absolutely. I think your background and your definition of the beginning of Agile is very accurate. It was started almost about 30 years ago now in software technology, and automotive industry. And the idea was how do you use engineers, technologists, and help them create new innovations, new technologies, new models faster, and cultivate new innovation faster. And it's sort of bred there, and it has grown in any technical company if you've ever worked or looked up Agile. And fun words like Scrum and sprints and waterfall, all of these things sort of came from engineering and technology world. And we've been seeing a transformation of this fancy word of Agile move and grow into healthcare, health technology, medical, more and more over the last, I would say about a decade, if not more.
So in the beginning, there was this guy named Edwards Deming. And, Edwards Deming went to Japan after the war, the Second War, and he helped rebuild everything they did manufacturing. Prior to that, Japanese manufacturing was not thought of very highly. But Edwards Deming went there because in the United States, nobody wanted to listen to him. So Toyota did pretty good, and they brought some of this stuff back to the United States and kind of started that total quality movement. And so when I think of Agile, I think of it as part of this Six Sigma, Lean Six Sigma, total quality management. And then maybe the next level down from a Lean Six Sigma is this thing called Agile. And you mentioned a few other things like Scrum and waterfalls and things like that. Does this become a very technical topic that people have to learn and really get trained on? Or is it more intuitive philosophy?
It scares people at first because we use these big terms, and we use terms like Six Sigma and being certified and being able to be efficient and process driven. And if you are in healthcare or a hospital-based system or medical manufacturing, they start to become a little scary words. You're already innovating, living, and helping patients in a scary arena anyways. Right. And now you're telling me I have to learn something new, that's technology and software. So I think sometimes it gets perceived that, this is going to be way too hard. I don't want to learn it new. I like the way I do things in my hospital or my clinic or my healthcare manufacturing company. But in reality, I feel like from my experience in healthcare and what we've been seeing different hospitals or medical companies using Agile, it's actually made them more efficient, more creative, fast to market, You mentioned quality. Obviously, quality of care, quality of patient care is a massive, massive need, not only based on currently what we're going through around the globe, but even prior to that. And being agile basically just means being more nimble, easier to work with, faster, data-driven, and making sure you have the right connecting points so you can come and translate to the proper answer you're looking for. So if you start to sort of slow down the explanation of this technology and this big word of agile, I think you break it down, and ironically, that's what agile means, is break down the problem one step at a time. You actually find that the correlation between healthcare and the attributes of agile are very similar.
Yeah. Some people, if you say this involves math or numbers, they go, a calendar's got numbers on it. I don't like calendars. And then you start talking about a sigma, standard deviation, and you got, is it sick or is it six? All too confusing. But when you think about the industry at large, and you think about the challenges that healthcare has been going through for a long, long time, it's no secret that our system is not efficient. Our system is not a healthcare system. And we've interviewed several people, for this program where they've written books on things that are gone wrong. Marty McCary, Dr. Marty McCary, the price we paid, just terrible things. And Dr. Vivian Lee, she talks about the long fix. And all these people are telling us about the problems. But when you stop and think about the nature of these problems, it all comes down, I think, to improving the patient care and the patient experience. And so just a historical perspective, I don't know if you've ever seen, this YouTube parody. It's called If Air Travel Worked Like Healthcare. You have to Google it. It's absolutely amazing. If air travel worked like healthcare, and it goes through a scenario where a person is trying to make a flight reservation, and instead of it working efficiently and just painlessly, it's like, we can't do this. It's 7 minutes long. We use it in our classes, but you'll have to pull that thing up. Because technology, wouldn't you say that technology in healthcare is not up to speed with the rest of the world in technology?
Oh, absolutely. Healthcare, for some reason, you would think should be at the technological forefront. Mm-hmm. And we, at least in the United States, we can talk about different markets around the globe, but at least in the United States, we have not been technologically advanced when it comes to healthcare, patient care, as well as providing easier access for care for our patients. And you're seeing that change happen very drastically. Even if you take the last 5 months of the COVID global pandemic we have seen and are going through out, even if you look prior to that, you are seeing change management happening in healthcare using technology. Think of things like telehealth, telemedicine, virtual care, advancements in third-party payers, managed care, pre and post-op care, right? Those are all things physicians, specialists really care about, but you start getting into this big healthcare system and somehow it gets lost. I have a technology background, so it's easy for me to say, oh, the technology is the easy part. It truly is in most scenarios. It's the implementation of technology, right? Hence your example of booking the airline. You cannot do anything even today of just as simple as 1 or 2 or 3 clicks to get a procedural answer or a recommendation or a cure to your relative symptoms you're having. And processes like Agile can really help organizations, hospitals, clinics really step up in this area of patient care.
So when we stop and look at technology today and we say the status quo says we've always done it this way, let's find a new, better way of doing things. There's a lot of resistance. And if we look back over this 100-year journey, just go back 100 years, I I remember one of our classes here, we talked about a guy named Ernest Codman. He was the first doctor ever, this is back in 1895, the first doctor ever that really did patient care monitoring from the first call to the last call. He followed up on everybody. He tracked all the outcomes. That's 100 years ago. Somehow that didn't catch on right away. And then we had this thing called the Joint Commissions. That was 50 years ago. And they said, look, we're all about improving safety and quality and all of that. And then 40 years later, the National Committee for Quality Assurance, they say, we've got to do a better job of all this healthcare thing. And then in 1999, the seminal paper, To Err is Human, Building a Safer Health System. And it's like, when are we going to get on with this thing? And then Leapfrog, just a year ago, Leapfrog Hospital Safety Guide, they published 161,000 preventable deaths occur each and every year in U.S. hospitals. Now, we see on the news every night that, 150,000 people have died from COVID-19, but every year, 160,000 people, preventable deaths. So I bring all that up to say, Arti, where do you start with a project? Do you go after the big things, or do you start with the smaller things? How do you engage with your clients and get them thinking about an Agile methodology?
You're right. These are big problems to solve, and they're big systemic and cultural challenges as well. So I would be silly and naive to say, yep, let's just start and solve it all at once. What we do is, and this is at the core thought process and core sort of learning of Agile, is you break the problem down into small chunks and small pieces. You can't solve everything at once, okay? So what is the biggest opportunity for growth in a short amount of time when it comes to patient care or patient experience or patient data or connectivity to patient? And the reason I bring up those four topics is normally it's one of those four in a health system, health practice, or a hospital, right? They're trying to solve for one of those three. And then you pick and you say, all right, let's back up. Now, let's sort of take baby steps to it and say, what small, tangible approaches do we have to take either on the business side, on the physician care side, on the technology side, on your location and institute side to help you get there? What are the great things that you're doing? And what are little tactical movements we can make to get you to that end goal? And that really helps, in my experience, with any of our healthcare clients or hospital clients. It really helps them sort of take a step back and say, okay, first, it's not like solving world hunger yet. We can do it. Secondly, we can take small steps. Third, we can make small investments. It always ends up being about cost and investment. We can make small investments and we can measure return. And that really helps you sort of change the conversation of this thought process of Agile and moving things forward in the health system.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
So back in the day when a major quality program was being rolled out, you wanted to get it to cascade down through the organization. You wanted the CEO to say, we're all about this, and get all the managers to buy into it. Is that the way it is with Agile, or is Agile from the bottom up approach, or is it both?
It's actually I would say sort of neither. So you use the word cascade, and that is one methodology that's used today, which is called waterfall. I had mentioned that earlier.
Mm-hmm.
And just imagine a waterfall, right? It starts on the top, cascades down. And that's one way of running a program, any program that you're talking about. Agile is different. And I think that's part of the reason it hasn't caught on steam in healthcare as much as it is in other environments. You need representation in Agile from every division and every team. So you have a leader of the project. However, you have people on the table that are from IT, engineering, marketing, patient care, physician, your facilities management, because that's a big need in healthcare. Sometimes even logistics and distribution, depending on what problem you're trying to solve. And everybody is hands-on in. Everybody has a say, and everybody is working towards that end common goal, whatever our common goal is that we decide together it is. Versus this idea of, I have given a directive, I'm a chief of staff or chief of nursing, and this is what I want done. And that's a key differentiator between just the process and the management of this methodology per se.
Well, I know if you go to a large academic medical center or a large, public medical center, just finding a place to park and how to get in the door and what floor are we on and who do I see? Boy, that's just a small thing that makes a big, big difference. And I can see that if you could find ways to make that more efficient and, be very rewarding right away, you build your brand that, you care about the patient more. I know a lot of the big hospitals around here, they've got valet parking now, and they want to really welcome you in and make sure that you have a good experience. So I can see where that would apply. There's a thing out there. I was doing some research and I didn't realize it, but there's this Agile manifesto, the Agile manifesto. And it's like, whoa, these people are pretty serious. Whenever you write a manifesto, that's like usually the Unabomber had one and some other people had one, but they said, we've got these principles that we're going to follow in Agile development. And whether it's software or not, but, deliver your stuff frequently. And business people and developers must work together. Those are the things you're talking about. The most efficient and effective method of conveying information to and within a development team is face-to-face conversation. And in today's modern world where, your kids text each other, they're sitting in the same house, and, the same thing in an office building, if there's such a thing as office buildings anymore, people aren't doing those things. But the simplicity of this approach, and they said, look, it yields great results. You don't wait for the end of the project to say, oh, that didn't work. Get involved in it a little bit more. Do you see that manifesto really working in the healthcare world too?
It's funny you mentioned the manifesto and these hundreds and hundreds of thousands of pages that have been written around. I think that's where the mistake happens. People get scared. It's not about scaring you. It's about making your process and your outcome and your delivery better, to have a better continuum of care, to make your patients feel more safe and secure, and to help with their health outcomes, right? In whatever capacity they come and they interface with you. Some of the things that you mentioned, breaking down the problem, getting teams involved, having an open, collaborative communication and team. These are simple tactics. You don't need massive infrastructure changes to do it. You need time, you need energy, and you need people involvement to do it. And I think sometimes with these large books and manifestos and documentations, you lose the point of what you were trying to achieve in the first place versus you're skipping through this a 10,000 page book. I would say it's no different than, I haven't been to one of your classes yet, but I would have to imagine, like any accredited professor, you give great knowledge of what others are doing that is in a written and or a book format that we study. But the idea eventually is take that back to your healthcare organization, make it your own, figure it out. And Agile is no different. Sure, could I come and deliver that 500 page book to every single one of my clients? can guarantee you they would not call me back. Right? Or I could sit with them and problem solve, break it into pieces, and help them get to their conclusion faster, timelier, and help ultimately with better patient care.
So we started off with being adaptive and innovative. And I know you said you have a technology background. In today's world, we're seeing things change so quickly from the technology side of things, just like we're using Zoom today to record. Mm-hmm. And typically we would be in our studio, and we're finding that, hey, this works pretty good, actually. So we're adapting a new way of doing things. And one of the things that we teach in one of our graduate classes here is basically, what is your digital business model? And I'm sure that's got to fit in to Agile. The things like the Internet of Things and mobile. And do you actually have a model? Most people are sitting there going, what's a digital business model? So is that some of the things that you consult with as well?
Absolutely. Absolutely. We look at tactical and measurable ways to take your current healthcare practice, division, department, and digitize it and make it into a digital engaged platform with your end patient. Whether it's things like telehealth or telemedicine, which I know sounds very scary to implement, but in reality, it actually isn't that hard to implement. Or whether it's virtual care, whether it's sensor-based technology that a physician can sit in his or her office and actually get good measurements, acoustics, breathing signals to actually diagnose and then prescribe to who they're talking to based on patient care, or whether it's chronic disease management, which we suffer a lot with in the US, unfortunately. But again, because of this global pandemic of COVID that we're going through currently, has had major challenges if you have a chronic disease that you need to manage. So yes, to answer your question, we work very closely with our clients to say, how do we digitize this connectivity? How do we give you the access to patient level data with all the compliances built in? And how do we help you make sense of it? So ultimately, the physician, the specialist can be ready to go in regards to taking care of their patient, and they can also be transparency and communication.
So these sound more like transformative projects.
Yes, they are anywhere between, on the short term, we have been lucky to do projects for 9 months, 10 months. On the long term, we are in there for about 12, 18 months. But again, if you think of the timeline, it's not exuberant, right? I didn't say 10 years. I didn't say 5 years. We are not building hospitals, which take a much longer project, or we are making iterative changes within your current practices to drive results in patient care and patient health and patient management.
Some environments, there's a new medical school down in Austin, Texas, with the name Dale on it from the computer guy. And their philosophy is to have a no waiting room. Now, I think that's got to be pretty innovative. And when you have something new like that, I think that's a great opportunity to change the way you're thinking and get people to realize there's better ways of doing things than the way that we've always done it. And I think that's what the Agile philosophy is really leading up to here. So a typical engagement with your clients, who do you start with? Just kind of give us a little day in the life, if you would, just a brief scenario of what it takes to get people to stop and listen and say, let's do Agile.
Yeah, that's, it's sort of different per health system or organization. If I'm working with a medical manufacturer or a distributor, it sort of starts more on the chief product officer or chief innovation, or even on the marketing or digital side of things. And that's where sort of our conversation at least starts. And if I'm on the hospital, health system, clinic side of things, it's either your somebody head of information technology, patient engagement, as well as sort of on the payer side of things, insurance payer programs and things like that. Because again, they want this fluidity between the health system, the physicians, and the end patient. Lately, I would say over the last probably 18 or so months, we have been getting tapped a lot by direct physicians themselves, who are either opening their own practices or a conglomerate of physicians that are coming together, or they want to ideate and they want to build. They've had this phenomenal medical background and degree and education and experience, but they're lacking sort of the business processes, the operational processes, and the innovation side, a lot that you teach in your courses, and the how do I make it happen? I know here's a gap. I see it every day as a physician. How do I actually change it so I can provide better care and management? And that's sort of where we come in, start having a conversation, and then come up with a short-term return.
Well, I think that's where we're going to head up here with this Agile approach. If we can get people to embrace in the healthcare organizations that these practices actually work, and with them to adopt the new knowledge and the new processes and things like that, we'll actually have a chance of improving the healthcare system. There's so many great things that we do, but once again, the 160,000 preventable deaths, there's a lot of work to be done there. So I'm just so delighted to have you on today to share this. And if you've got some reference links that you'd like to include in this podcast, we'll have other people respond back and give some insights as well. So appreciate your time today and look forward to learning more about Agile as we all grow with this new experience.
Absolutely.
Thank you, Arti. Very, very, very good engagement here with you.
Same here. Thank you very much, Bob. And glad I was able to share some little bit of insight into this massive world of both Agile as well as healthcare and patient care. Thank you very much for having me.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.